The beauty scientists, Dr. Kirsty Hamilton and Dr. Roy Kim. Real beauty without the hype.
So let's talk about the most powerful solution. What's the most powerful solution for addressing a sagging jawline?
The most powerful solution is, of course, facelift neck lift. So we're able to reposition your fat in your underneath the chin, the submental fat. We can reposition the muscles, the platysma muscles. We can actually reposition the skin so we can actually tighten it and remove a little, as well as sort of pull it back behind your ear, around the earlobe and in front of the ear. What's interesting is that as plastic surgeons, we know that the jawline itself is a combination of the neck and face. It's right at the interface or border. So depending on your situation, most patients honestly need a facelift neck lift. Some patients can get away with just a neck lift, but it really depends on your situation. And repositioning all those structures is much more of a procedure, like a surgical procedure as opposed to non-surgical. Finally, to augment your chin and jawline, you may need a little fat placed here, or you actually may need a chin implant. So those are the things that we think about as plastic surgeons to give you sort of the gold standard, the best jawline possible. Anything else that you discuss with your patients, Kirsty?
I think that is really talking about the chin and profile balancing. That's really important too. You want to make sure that the jawline looks good from all angles. And then finally, when we're talking about revealing a jawline, perhaps the patient has like the most perfect mandible, but if they've got a lot of fat underneath, then sometimes something as simple as submental or chin liposuction can be a really great way of revealing a beautiful jawline, or it could be performed in conjunction with a small chin implant or some jawline filler. But yes, like you said, face and neck lift, that's the gold standard. That's going to give you sharpest, tightest, sleekest. So when patients come in, if they want a little lift under here, I say oftentimes we can get away with a little liposuction, but if they're doing this and pulling their face up into the side, that's surgery, that's a face and neck lift.
Yeah. And as plastic surgeons, we both know if you want the maximum result, yes, it's surgery, but also the technologies that tighten skin as a plastic surgeon, they work, but they don't work quite as well as I think a lot of consumers think. As you showed, if you're really moving the skin a lot more than half an inch or an inch, I don't think there's any technology that's really going to tighten skin that much.
I haven't seen it. You haven't seen it. And if it existed, I always tell patients, if these things existed and worked reliably and really well, we wouldn't do facelifts anymore, and we do them all the time. So right. Once we stop having facelift patients, then we'll know the technology has become that good.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.